how is an African American rhinoplasty performed? You know, what's different about that as compared to Caucasian rhinoplasties? So I call them an ethnic rhinoplasty. Sometimes I'll call it a mild westernization rhinoplasty, because my goal is not to get a very small nose, but to get a nose that still fits the patient's face, but it's slimmer and sleeker. So what do we do in that situation? The first thing I like to do is work on the tip. So we have a tip that's very round and flat. I want to increase the projection of the nose. I want to make the tip smaller. So if we think about it, if we have a big tent, a big party tent, big square party tent or rectangle, and I put a pole in the middle of that tent and push it up, it becomes more narrow. So the more projection I add to the nose, the smaller that the nose and the tip will look from the front. Once I've worked on the tip and I think that it's appropriate, and remember, thick skin limits what we can do. So we don't want to remove a lot of cartilage. If we do that, the nose will collapse. But once I modify the tip cartilage, add projection, which makes it look better, then I work on the dorsum of the nose. Sometimes I'll bring the nasal bones in, but many of the times I'll have to augment this part with cartilage after I bring the tip out. Because usually the nasal bones are very low in African Americans. I bring the tip out. It used to be pushed in and wide. Now it's elongated and a little slimmer. I'll have to add cartilage here. Now, how do I add cartilage? Some doctors will put an implant there, made out of Gore-Tex or silicone. Other doctors will use a big piece of rib or a piece of septal cartilage along the dorsum. What I like to use is tissue called fascia from the scalp, from the temporalis area, or a piece of tissue from the rib called perichondrium. I'll place that tissue underneath the skin, and then underneath that, I'm going to inject finely diced cartilage and I mold it. And it's soft, but it's not too soft, but it's firm enough. But it's something that I feel after time I like the softness, but at the same time it has some firmness to it. But I think that the finely diced cartilage is something that I really, really enjoy using. And then I can gently match the profile with the tip. Once I'm done with the whole upper 2/3 of the nose and then the tip, next we have to worry about the nostrils. I make the little incisions called alar base incisions in the crease, and we bring this down. We want to bring the nostrils in. Sometimes if the base of the nose is wide, we'll carry those incisions inside the nose. It's a combined Weir/alar sill reduction, and we'll bring the whole nose in. Usually if we do this, this is the complete aspects of a African American rhinoplasty. We're dealing with the middle part of the nose, the tip, and the nostrils. So we're bringing everything out as making it somewhat Caucasian, but not overdoing it.